everybody, it's Craig Fitzpatrick from Hosmer Chiropractic, and today we're going to be going over the active figure 4 hip stretch. This is a great hip stretch if your hips are locked up, in particular if you have sciatica or sciatica type symptoms, or if you have SI joint problems. This is a great stretch to help relax the tight muscles that usually make those two issues terrible. So in order to do this, I want to sit on something that's going to put me at a right angle when I'm sitting, basically. I don't want something too low that's going to cause my back to round, and I don't want something too high like a bar stool where I'm not going to get that effective of a stretch. Now, if I wanted to get drunk and go to a bar stool is an excellent option. But for this, we're just trying to stretch the hips. So maybe do this stretch first before you go to the bar. Moving on. To do this stretch, I'm going to take my right leg and I'm going to cross it over. I've got my right ankle resting on my right knee, and I want my leg to be fairly horizontal as I do this. I don't want to be pulling up on my knee, and I certainly don't want to push down on my knee like that. If we push down on the knee like this, we can injure the knee. We've had people sometimes that have done this and they have turned into a werewolf, and not a really scary or cool werewolf. This is a werewolf that complains a lot. So both for your knee health and to prevent you from becoming an annoying werewolf, do not push down on the knee, okay? All right, so now that we've established that, I'm gonna sit up nice and tall as I do this, okay? And for some people, this might be stretch enough at your hip complex. So you're up nice and tall like this, and then if I can tolerate this, the next step is to make it an active stretch. So what we're going to do is I want you to imagine that there is a steel post going through your skull, through your neck, and through your spine, all the way down into your sitting surface. And what I'm going to do is I'm rotating my hips back and forth like that. It's almost as if I'm trying to take my right knee right now and trying to pull it back into my hip socket, and I'm trying to push my knee forward. Pull it back, push it forward, pull it back, push it forward. And if you're doing it correct, you should feel a good stretch in the hips. The reason why we want to make this stretch active is these very powerful muscles we have in our hip, they get worked a lot. They're responsible for a whole bunch of things, from force production and stabilization of our body. And what can happen is over time, the muscles, instead of being able to slide against each other, it's almost like they get laminated and stuck on top of each other, which causes a whole bunch of crap that we don't want and discomfort, blah, blah, blah. The way to get around it is to not only stretch it, but try to get a little bit of an active stretch or movement in while we're doing that stretch. So again, think about 10 to 15 reps. What we don't want to do when we're doing this mobilization, I'm not sitting here and I'm not just like, wee, wee. Again, that's something you can do at the bar after you have a few in you, but when we're trying to do this hip stretch, it's not going to be beneficial for those tight muscles. So think about that imaginary rod through your body, sitting up nice and upright, and I'm just pulling the leg back and trying to push it forward, pulling it back and forward like that. So now I know what you're thinking. You're thinking, Craig, what if I'm out and about and I don't have something to sit on? What if in the wilderness? What if I'm in the wilderness and there is no 90-degree chair for me to sit on and do my hip stretch? Well, true believers, have I got something for you. What we're gonna do a standing version of this. Yep, it's not even your birthday, or if it is, I apologize, and happy birthday. What we're gonna do is we're gonna try to find something sturdy to hold on to. Again, this is a stretch. This isn't a balance exercise, okay? You don't have to impress anyone right now with how great your single leg balance is. I'm gonna hold on to something so I can emphasize the stretch, but it's the same idea. I'm gonna keep my back really straight as I do this. I don't wanna let my back round and collapse. And what I'm gonna do is I'm gonna push my butt back. And again, I'm feeling a really good stretch here in my hips. And what I'm gonna do is I'm again trying to pull my knee back and then drive it forward. Back and forth like that. Another thing you can think about is trying to keep your shoulders stable as you do it. So just think about, it's just the hips that are rotating like that. So that is another option. Sometimes people also like the standing option over the sitting option if they feel too much friction when they're trying to do it, the seated version. So again, things to go over. We want to make sure if you are sitting, you're doing it on a 90-degree angle for your hips. We want to make sure that the back is not folding over as we do this. We want to keep the back nice and straight. And we also want to make sure that we are not pushing down on the knee or pulling up. We're trying to keep that fairly level as we do that. And then if you're going to do the standing version, make sure you have something to hold on to, especially if you've accidentally gone to the bar first and had a couple drinks in you. Do not try to do this mobilization while schnockered. Don't. No one wins in that situation. All right? If you have any questions, please feel free to reach out to us here at the clinic.